Cat-borne diseases cost Australia $6 billion each year. A new study published in Wildlife Research looks at the rates, impacts, and economic costs of toxoplasmosis, cat roundworm, and cat scratch disease in Australia. The authors based their findings from a large number of Australian and international studies, Australian hospital data, and information from the Australian Bureau of Statistics. Their estimation suggested that over 8,500 Australians are hospitalized each year. A further 550 individuals die annually from causes associated with these diseases. The researchers then calculated the economic cost of these pathogens. They found that cat-borne diseases cost the country more than 6.06 billion Australian dollars each year. Toxoplasmosis is a cat-dependent disease caused by the parasite Toxoplasma gondii. Infected cats release millions of Toxoplasma gondii oocysts in their feces. Humans become infected with the parasite when they ingest the oocysts through close contact with the feces, especially in contaminated soil or litter box. Cat scratch disease is a bacterial infection when humans get scratched or bitten by felines with Bartonella henselae bacteria. Cat roundworm is a parasitic infection that humans and other animals can contract if they accidentally ingest the egg of the Toxocara catty parasite. Toxocara catty can be found in the feces of infected cats. The authors said there are studies that suggest that Toxoplasma gondii infections increase risks of car accidents, schizophrenia, and suicide. By taking these issues and risks in the Australian context, the country could potentially avoid 200 deaths and 6,500 hospitalizations due to car accidents, 300 suicides and 4,500 suicide attempts, and 800 schizophrenia diagnoses per year. Around 700,000 cats and 2.7 million pet cats wander Australian towns and suburbs, acting as potential hosts of feline-dependent diseases. Improved waste management and fencing could help reduce the urban feral cat reservoir population. There are no human vaccines to treat these diseases. Treating cats with Toxoplasma gondii infection is not useful. This is because they release the oocysts without the owner realizing that the cat is infected. Cats can undergo roundworm treatment. However, treatment for Bartonella henselae may not be effective. If you're a cat owner, it is advisable to keep your pet indoors or in a secure outdoor area. This could minimize its likelihood of contracting or transmitting pathogens. Wash your hands after handling your cat's litter box or soil to reduce the risk of transmission. Be sure to keep your cat away from children's sand pits or vegetable gardens. Following these safety measures could help us prevent the impacts of cat-borne diseases to human and animal health.